We're all going to die, and if we're very, very lucky, we're going to have friends and family around us and no discomfort. When you're going through cancer, it can't be an everyday thing, right? I mean, you just can't immerse yourself in the illness. 2009, I had a bilateral mastectomy. There was no lymph node involvement. So when you hear that, you automatically assume, okay, I'm winning this one. I can get through anything, but I'm winning this one. So it was very shocking to discover this January that it actually had metastasized to the lungs and the brain. You know, everyone's diagnosis is so different. And the way they handle it is so different. And the first little part of it, you just feel so completely out of control, I think. Or I think a lot of people feel just completely out of control. After the initial diagnosis, that's sort of shattering, and then you regroup. And I guess the most precious thing was my experience with the family during that initial shattering diagnosis, because that sense of being surrounded with their love was huge. That was earth-shattering. That was the most important thing. I think many of us, including me, always felt that palliative meant you are on the end run. You were here and now you're all falling off the cliff. And that palliative care is end-of-life care. And I mean, I see it for myself as end-of-life care. Dr. Reutemann could have 6 different chemos he can try on my lungs to continue the process. But then eventually one of them stops working, and he basically will say to me, we can't give you anything more. So then it's over to Dr. Horvath, who will help manage my symptoms, help us access hospice with the social worker, and that type of thing. They know that the tumors that are in the brain are the problematic ones. And, you know, I tried to get one of our doctors to pinpoint where they are, simply, and how that it affects the function, because you can't help but want to know, when I fall off this cliff, cognitively, what is it going to look like? Is it going to affect my speech, my cognitive functioning? Or am I going to become like this crazy lady who's screaming obscenities at their family, completely changing the personality of who I am or who I want to be? And that part is the part that's difficult. We all left Dr. Horvath's office feeling very comforted, knowing that we were going to manage. And as Dr. Horvath said, I mentioned it to you earlier, that, you know, birth is a mystery. We go into it not knowing what it's going to feel like, how we're going to manage it. She said death is the same. It's a mystery. We don't know. We don't know how much pain there's going to be involved or how long and protracted it is, but we will deal with it and help you. We had an appointment, and all the kids were there, with a palliative care doctor, and who's a wonderful person at North York General. And so we expressed these kinds of concerns to her. And she gave us a great sense of peace, which is where the palliative piece comes in, because there is so much that's unknown about this stuff. And all you really want to know is that you're not going to suffer and your family's not going to suffer. So she said, we can deal with physiological pain, we can deal with emotional pain, and we can deal with existential pain. So in other words, we've got you covered. Your family know who you are. If your behavior becomes such that they know you'd be unhappy with that, she'll be able to deal with it. So it's, I mean, part of it is the time frame, but it's, you know what, it sounds sort of like a hackneyed phrase, but it's really more about the quality of life, that you want to hang around, but not at the expense of the quality of your life. My plan was that I would die in hospice. I would not impose the dying in my house because I felt that the house was a sanctuary for the family and that was something I was depriving Mike and the kids of. And things changed. Dr. Horvath said to me, you don't have to make up your mind right now. This is a process, and it's something you can think about long term. So, funnily enough, Mike and I have been measuring for a hospital bed and, can the sofa fit here? And I can see my birds and the trees. And he said that would be my choice, not only for me, but for himself. So that's kind of where we are now. We don't go into a marriage thinking we're going to be living without our spouse. So of course it's sad, but it is what it is. And so it's all about, so what's important is knowing that not only can you manage it, but that they're going to manage it. We have developed this conversational ability to talk about what his life looks like afterwards. And I think it's really helpful because I think that there's a lot of loneliness that happens for a widow or widower, gaping holes of loneliness. And, what does your life look like? Like, how do you carry on with the family and keep them there and keep them in the heart of the home when they're here? Where do you travel? Who do you travel with? Just what does it look like? So I think for Mike and me, that has given me a huge amount of comfort to know that he can actually talk about it. It's huge. I think it's very hard for the kids, and I think it's hard for Mike, but I'm pretty realistic. I know what's coming, and sometimes I'm scared and sometimes I'm not, but I can deal with it. And that the whole palliative thing for me, it's really about, and I think I've already said it about 3 times, but it's really about giving me energy to my days, joy in my days to do what I need to do. And I don't really focus a lot on the illness. I'm very lucky because I'm retired and I don't have small children to worry about. I don't have a job to worry about anymore. So I recognize that I'm very lucky. But I think also for other people, there are a lot of resources out there like Wellspring and Willow. Willow is for breast cancer specifically. Wellspring is support for any kind of people with cancer, family members, children, and so on. And they have so many resources. So to go out and get some help with emotional support, spiritual help, exercise, nutrition, anything that makes you feel better, that's the key. If there was a battle that I didn't believe I was in, was 2009. Now, and I didn't believe I was in a battle, I was just going through a process to get to the other end, to resume my life without chemo and without the disease, or recovered from the disease or whatever. Now I feel that I'm in a process of living and trying to aim for the highest quality of life I can and enjoy it. It's such a great exercise for anybody actually to say, what would your 80-year-old self say to your now self? So I'm 63. What would your 80-year-old self say to your 63-year-old self? And I think my 80-year-old self would probably say, good job. What would your 63-year-old self say to your 20-year-old self? It would be yourself. Don't be a people pleaser. Do what you need to do for you. Somehow or other, you have to get yourself in a headspace of living in the moment, because it's the only place to be. When you have a terminal diagnosis, living in the moment is the only place to be, because that's where all the good things reside. Your friends, your family, your love, your humor, things you like to do, and that is probably the key. It doesn't preoccupy me. I think about it sometimes. I think about many of the pets I've had, birds, trees, just the natural world in general, it gives me a lot of peace. I don't know if I go somewhere. That's the whole mystery of it. And you know what? That's part of the mystery of dying too. You don't know. Nobody knows. So you have to somehow or other find peace within that knowledge, that lack of knowledge. I remember once a psychologist at Wellspring said to me, you know, there are worse things than dying. And I do believe that. And I do believe in our country, and particularly Ontario, with OHIP, we have all the resources, all the support to help us. And for me, I don't have financial worries. As I said, I don't have children to bring up or a job to go to. In the grand scheme of things, I'm pretty lucky. And I don't know if I'm afraid of dying yet, because I'm not there.